So our last speaker is Scott Kleiman. Scott is a program director at the Harvard Government Performance Lab. He has been embedded in the trenches with multiple governments around the country. So he really has lived this in his experience. I just want to tell a quick story. So we were reminiscing when Scott got here about the last time that we'd spoken. And it's been a while. It's been almost exactly 3.5 years. And he asked me, hey, when was the last time we talked? And I said, actually, I know exactly the last time we talked. It was the day that my son was born. And so we do a conference every couple years, big CRA conference, and we move it around the country. And back in, I guess it would have been 2014, we did it in Chicago. And at the time, Scott was embedded with the governor of Illinois, and Scott had graciously agreed to speak at the conference. And he also mentioned that there was a chance that we could get the governor maybe to say some things at the conference. That didn't pan out, but there was a chance. And it was all really kind of touch and go at the time. And so I'm in the labor room with my wife, and Scott calls. And I turn to my wife, Nicole, and I say, honey, it's Scott, and I have to take this. We're still married, so it all worked out fine. But I think that's the highest praise that I can offer anyone is when Scott called, I would literally miss the birth of my firstborn to speak to him. No, but in all seriousness, the Government Performance Lab at Harvard is probably the most impactful organization in the country in laying the groundwork for this whole outcomes-based funding and financing conversation, and that can't be overstated. This book would not have been possible but for that investment in the field and the technical capacity that they've built over the years. So it's with great pleasure I invite Scott up to the dais.
So I'm expecting a call from Anthony any minute now, given he just had his baby. The second thing I just want to say is that the video at the beginning stole my whole talk, but it's great because you now have a visual to go along with the story I want to tell you. The third thing is that because I'm up here, I get to do this. We've all been sitting for a little while, so I want everyone to stand up. We're going to get the blood flowing just for a moment. Reach to the sky, put your fingers up. All right, now all the way down. Now all the way back up. All right. Great job. I'm done, thank you. So I'm Scott Kleiman. I help run something, as Ian said, called the Government Performance Lab at the Harvard Kennedy School. Many of you may know us. We've done a lot of work around pay for success in governments around the country. And what we're really all about is helping governments tackle their hardest problems around delivering social services. So I want to tell you a story about one of the governments that we worked with. And specifically, I want to tell you a story about Seattle and how Seattle is using contracting, this pretty sort of simple mechanism, to overhaul their approach to solving homelessness. I'm going to tell you a little bit about the crisis in Seattle. I'm going to tell you about some of the challenges that the contract structure, that their data systems presented to them that made it really hard for them to solve this. And then I want to tell you a little bit about a pilot that Seattle has been embarking on to try and overcome these challenges. So in late 2015, Mayor Ed Murray of Seattle had a problem. Homelessness in Seattle was up 60% over the past decade. And yet no one could tell him conclusively why or what the city was doing wrong. By November of that year, the problem had gotten so bad that the mayor declared a state of emergency to raise awareness about the severity of the problem. But it wasn't as if the city hadn't been tackled this seriously. They had a 10-year plan in place to end homelessness in the city. And by the end of that 10 years, the problem was worse than when they started. They funded dozens of providers across the city to deliver shelter services, deliver case management, to try and deliver preventative interventions to families at risk of homelessness. And spending on those services had almost doubled over the last decade as well. And yet, despite this work, the city still couldn't answer the fundamental question facing the mayor. Why was homelessness going up despite spending going up? Was it because of scarce, affordable housing in the Seattle area? Was it because jails and substance abuse treatment providers were not effectively discharging individuals? Was it because the generosity of services in Seattle was attracting individuals from neighboring communities? Was it because our counts weren't perfect? Designing effective policy solutions requires us knowing the answer to these questions. And the disconnected structure of the homelessness service system in Seattle prevented them from being able to even start to begin to have these answers. To help address these challenges, Seattle asked for help from the Government Performance Lab as part of Bloomberg Philanthropies What Works Cities initiative that you heard a little bit about before. And this work began by trying to unpack what was going on. And there are three big challenges. First, the city had 176 contracts across 60 different service providers for homelessness services. One provider alone had 18 contracts with the city. And each of these contracts was highly prescriptive about the nature of homelessness services that funding could address, the target population of who could be served, whether it was perhaps a single mom or a veteran. And with each of these target populations came requirements about metrics that the provider had to report on, which were different for every contract, and restrictions about how the funding could be used. So when the single mom, who was also a veteran, showed up for services, those services had to be managed independently from the funder. They couldn't pay for things together. They had to be staffed independently. This is obviously burdensome for the provider. This is also really confusing for the client. Second, the data systems that potentially could have enabled the city to begin answering some of these questions about homelessness were disconnected, were siloed. This is not news to anyone. There were 4 different systems that had emerged in Seattle. The Homelessness Information Management System, which in theory was the comprehensive system that was designed to collect information from every provider about what services homeless individuals and families got, was unreliable. Providers had to double enter data into their own case management systems and HMIS, and it was just hard, and it took a lot of time. And so HMIS was incomplete, and so the city didn't manage towards it, and they created 2 other reports to try and get the information that should have been in HMIS, and suddenly there were 4 systems, and it was self-perpetuating for providers, because if the city isn't using HMIS, why are they going to enter data into it? And as a result, this disconnected system didn't allow Seattle to be able to track individuals through their homelessness experience. We couldn't tell whether there were a small group of individuals who were consuming lots of services, whether people who we thought had been housed were returning to the system, returning to homelessness after only a few weeks. Thirdly, the way that the city partnered with providers was oriented around activities, a lot of the themes that we heard from today. Providers were asked to report on the number of meals served, the number of individuals who spent a night in a homeless shelter, the number of showers that were taken in a given night. These all things are important, certainly, but they don't help us understand our progress towards what we ultimately care about: housing people stably and preventing people from becoming homeless when we can. These problems, these challenges, they're not unique to Seattle. They're not unique to homelessness. In fact, Seattle's Human Services Department is one of the highest performing in the country, committed to data-driven work, committed to being forward-thinking about policy solutions. And yet, again and again, we at the Government Performance Lab see governments treating their contracts and their contract management as a mechanism for preventing fraud and abuse, something that needs to be overcome, something that needs to be gotten through, rather than sort of strategic opportunities to think anew about how service providers and government can together work on solving the things that we're aiming to solve. One of our government partners has called this phenomenon pay and then pray. So what can we do about it? So with help from the Government Performance Lab, Seattle embarked on a pilot to try and transform its contracting to ultimately solve homelessness. There were three big things. First, they consolidated contracts. So they reduced by 2/3 the number of contracts that providers had with the city. This simple step unleashed flexibility in how they could use dollars. So suddenly they could use dollars on the things that actually could help keep people housed or get them housed, whether it's paying for interview clothes, paying for a security deposit, paying for certification to get a food handler's license. The second was that instead of having these ad hoc metrics that were different for every contract, they created a standard set of 6 performance measures that were linked to the things that the city cared about most. So now every provider gets measured upon the number of families that they prevent from becoming homeless through some preventative intervention, the number of families who get housed, the number of families who stay housed, the number of families and individuals who don't stay housed, who return to homelessness, and then barriers that are busted, things like getting a license or getting enrolled in public benefits. The third piece was changing the nature of the relationship between providers and government. So instead of looking at their contract management as a focus on making sure that there's no fraud or abuse in how our dollars have been used, Seattle is now embarking on high-frequency, data-driven meetings with its providers. We're focusing on creating the feedback loops to continually improve. So every month, Seattle's contract managers and providers sit down individually together, and they look at progress along these 6 metrics and troubleshoot program-specific problems. Then once a quarter, executives from all of the providers across the system get together with leadership from government, and they look at population-wide outcomes and identify opportunities to shift the system as a whole. So through this combination, Seattle now has insight into how resources are being used and what programs are working, and can make smarter decisions about how to allocate resources across the service array. We also are learning what's working and are identifying the best practices that can be shared with other providers. And lastly, we're establishing the foundation around the data infrastructure to answer some of those questions that the mayor asked at the beginning. The early results are promising. Of the pilot providers, one of them reported more of a 50% increase in the number of placements into permanent housing during the first 6 months of the pilot compared to the second 6 months. And the mayor was so encouraged by this results that earlier this summer, he announced a new request for proposals for the entire homelessness system that would spread these results-driven contracting practices across the entire system. So it's hard. Their governments fall into this pattern again and again of focusing on getting the money out the door and doing it in a way without fraud and abuse, but not emphasizing enough what happens otherwise. Seattle gives us a perspective on a different way, that with collaborations around data and around results, that on any number of issues, we can begin to move the dial. Thank you.
Thank you, Scott. And Lisa and Tyler and Ishana, can you come on up? We're going to do some Q&A. We've got about 10 minutes before the break.
Great. I have a number of questions. I'll give you 3 to start, and you guys can decide how to respond. For Dr. Fitzpatrick, You're up.
Sorry, I forgot
What
my
about the
microphone.
role of home and community-based services within your vision, and how are those organizations supported? The second question, improving health, improving education, ending poverty could each get us closer to the outcomes we desire. Our fields are guilty of spending time drawing people to our cause. Glad people are on board with collaboration. How can we funnel our energy towards a common cause? And the third question, can funders support the shift to paying for outcomes, or does that have to start with governments?
Lisa, you want to take the first one?
Sure, but I'll just say something quickly about the last one. Anybody can do it anytime. Don't wait for government. You see, it's taken this long for government to move. So the question about how you incorporate what I call the wraparound services, the housing support, food support, employment, social support, this is really important, particularly now in the health sector, because we are shifting toward value-based purchasing, which is we are looking for outcomes. We're looking to pay for outcomes versus outputs. And at our program here, I didn't talk about DC Medicaid. I'm not here representing DC Medicaid today, but we do have a program we've just launched this past summer to pay for those wraparound services. The program is called My Health GPS, and the idea is if you incentivize healthcare providers, and most of ours are federally qualified health centers, if you incentivize them with additional payments on top of the payments they already receive, then we can pay for these types of services. So we're hoping that this will lead us down the path toward integrated chronic care that includes behavioral health and includes a lot of those social supports you're asking about.
I may take a cut at the first one and the third one really briefly. Providers who are going at risk or at risk for care know that when they care for someone with diabetes or hypertension who are lower income on Medicaid and have a lot of social and non-medical needs, that they need to increasingly make the assessment of non-medical needs and referral a standard of care. That needs to become a standard of quality. But beyond that, then, if you're going to make a referral to a community-based organization, you got to pay for it. You can't just push it out on the community. So what we see starting to happen is beginning to look at contractual relationships with community providers to meet the need to reduce preventable utilization, right? The logic of a health plan, not to reduce health, but to reduce preventable utilization. But it takes the kind of data that Ishana was actually talking about to really get there. But the future is moving to contracting with community-based organizations around those non-medical needs as part of shared risk arrangements. That's why we engaged Nonprofit Finance Fund to help build the capacity of the nonprofits in the community to be able to be in those kinds of relationships. And as a funder, we need to be seeding the innovations and testing and creating demonstrations that are proof points so that it can begin to be part of contracting and regular payment mechanisms. But that's the role of funders, is to seed it, prove it, and then move it into market mechanisms.
Thank you. I wanted to take a stab at the second question I think it was about how it can be one cause and not sort of how do we not split out into our own sort of issues. I had the opportunity to do some collective impact work before coming to Urban Alliance, and I do think there's something there with sort of this. If we all care about healthy communities, so having this continuum where we know early childhood is important, middle school transition, high school, workforce, and being able to come together as a community and us to be the ones to say, we have some programs that aren't moving the needle, and how can we go to our funders and say, what can we do together about this? I'll steal a line from Jeff Edmondson, who is part of the Strive Network, and he used to say that we're guilty of being program rich but systems poor. So like, how can we come together better around charting what each of us do best and what's really working, and then create the right kinds of resources for our communities? I think that's a way to think about it.
So I'll take a swing at the question of does government need to start this, or can funders start it? So what strikes me is an experience that we had in one government agency that will go unnamed here, where the government was thinking about, was planning to purchase a set of community-based services. And this was in a foster care context, and specifically about visitation. So these are services that are put in place when kids are in foster care. We put in place visitation to help build the parenting skills necessary to reunify families. And the department was thinking about rebuying those services, and discovered sort of halfway down this path that one of the foundations, the community, was about to go fund a large evaluation of visitation programs that all the providers had asked for. And what struck me was how discoordinated these two conversations were, and that money from a foundation to evaluate this program and figure out what was working in visitation in this context and what wasn't would have been unbelievably valuable for government if it was linked to the policy questions that the department had. But instead, it was sort of designed and funded completely outside of the department's context. And so we're going to learn a little bit, but ultimately it's not going to drive the decisions that the state makes about how they allocate resources as much as it could were that conversation more well integrated. And I think the lesson a little bit is that, you know, I spend my days sitting in government agencies, and I certainly know that they can be frustrating places, especially for outsiders to figure out how to get insight to. There are people like all of you in those agencies around the country, and looking for partners on the outside. Don't give up on our state agencies. Reach out to them. Try and find those people so you can do that funding in a coordinated way.
Can I just say one more thing related to the evidence, though? We already know a lot. We know a lot that could give us enough comfort to move forward, particularly funders. When we started our nonprofit, it was very difficult to receive any funding because one of the first questions you have to answer is, how much funding have you already raised? Well, you have to start somewhere. And the RCT is beautiful. Yes, it's the holy grail. But do you know how long it takes to implement an RCT, even design an RCT? And we are ignoring a lot of the data we already have. So I'm reiterating a point I made to particularly funders. The risk is even greater than what you think you're risking. But if you want to get to the place we're talking about, you don't have to wait for the RCT.
Well, that's a great point to end on. I wish we had more time for Q&A, but we were out of time. Please join me in thanking all the speakers.